I love that we're telling middle-aged women to work harder
Yeah.
when we have worked our butts off our
Yeah.
whole life, raising
I know.
children, running the household,
Mhm.
always, most of us have had careers. Anyway, I miss a lot of mental, emotional stuff. I also had a hard time with patients in that I was happy to prescribe hormones, and yet their GP was scaring the crap out of them. And everybody was telling them that the hormones were going to kill them. I'm sure you get these people on Instagram too. People call me a murderer sometimes in my comments. And I'm like, are you insane? Like, just go read some data, like go away. But these women would believe whoever was, maybe their OBGYN, whoever it was, telling them absolutely not, don't take it. I just had a patient recently whose doctor, it's crazy. She was going in for surgery, and I had a friend this happened to too. They were going in for surgery, and the doctor was like, if you don't discontinue your transdermal
Yeah.
estrogen patch, I'm
Mhm.
not, because you're going to get blood clots and potentially die. And I'm like, what are you guys like not keeping up with
No,
isn't that our
clearly not.
job to keep up?
Yeah. But, women feel stuck. They're like, I have to, when it comes to, I had a very similar case. A woman recently, she had to have surgery. She had a fall, and she ruptured her hamstring and had to have surgery. And we were kind of back and forth on the portal, and she said, oh, they want me to stop my patch. And I said, you don't need to stop. And I sent her the link, and I said, give me the name. I will send them the articles. And I sent everything, and they still made her stop. And she felt stuck. Like, they're not going to operate on her if she doesn't stop this patch. So she stopped it. And I just think, women are it's ridiculous that we're like making shit up.
The thing that gets me about the musculoskeletal part, and you said something earlier that I want to come back to, I only waited like a year and a half too long before I got that steady, I call it steady state estrogen. I was using topical, it just wasn't absorbing. And so I went to the patch. It took me about a year and a half to really figure that out, that was what was contributing to my pain picture. And from everything I've studied, and I'd love to hear what I'm such a nerd when it comes to musculoskeletal pain. Like, that's really my wheelhouse. And from everything I've studied, it sounds like it's the estrogen swings that really contribute to the pain pattern. And B, sometimes we can get too far behind the ball, and applying estrogen in some studies showed improvement in pain, and in some studies showed worsening. And so I think that bone, ligamentous, tendinous, soft tissue picture can shift to such a degree that now I am in a chronic inflammatory pain state. And even with the transdermal estrogen, I still can't get back to baseline of where I was before it all started.
I would agree. I think you can get too far and have not just your tendons, but be so inflamed, maybe your gut, that the estradiol makes really not a lot of difference to it. This is where I think GLP-1s are like magical, because they're going to give you that additional little bit of anti-inflammatory benefit and testosterone. Sometimes you have to layer one thing on top of the other to really get enough anti-inflammatory benefit to really move the needle on pain. But I completely agree with you. I think you can get so far behind, it's really, really hard to rescue the situation.
Yes. And I'm thinking of myself and the pain I had, and the short amount of time I was in it overall. If you think about it, it could have been the rest of my life if I had been born 5 years ago, or I didn't know what I know, right? And I wasn't able to advocate for myself. But I think of these women who were in my practice who must have been in the most exorbitant amount of pain, because they would often find me in their 50s and 60s. And they were postmenopausal, and I would plead and beg with them to just consider, let's try a trial run of HRT. And they would vehemently, you had to give them an endocrinology lesson to even get them to think about it, because it was like, no, that's going to kill me. They had that in their head. But the amount of pain that these women must be living in, and then as women, we just learn to accept it and shut up, right? We don't complain. And what these women don't realize is that their experience of pain is completely separate and distinct from everyone else's, because of the way their brain is wired. And it could have everything to do with adverse childhood events. It could have something to do with a gut infection. It could be a million things, the way that their body is presenting their pain or lack of. And the same person over here is dying of they scratch their finger and their pain is so pronounced and overzealous, and it's a whole, their central sensitization is all wound up. It's not, pain is so, what I have learned about pain over the years has been so sobering and humbling, because I was always like, I have a really high pain tolerance. And then all of a sudden I was met with chronic pain that just kept on and then got worse in perimenopause. And I'm not even menopausal yet. And I'm like, oh Lordy.
And I remember, I worked in the ER for a long time. I worked in orthopedics. I worked in urgent care. And historically, like, I cringe saying this out loud, and it's shameful. But, seeing somebody, always women, and she's in pain, and you would come out and be presenting to the other doctors, or, and be like, she says she's a 10 out of 10, but, she's sitting there comfortably. We just are so dismissive of women's pain. And this is somehow rooted in the way that we are taught medicine. We would never behave like that around a man, or somehow dismiss his 10 out of 10 pain as always making it up. It's in his head.
And women of color get it worse. I
Totally.
mean, it's wild. Yeah, it's wild. That's why I love your account, because you say all the things. It's funny because I'm sure you notice this. When you get to about 100,000 followers, they come for you, right? They really come for you, and you never wavered. You didn't shift. I watch most people get a little more tempered. Once you get to like almost 400, they really come for you. And my style on Instagram is a whole lot calmer than it used to be, because I used to just be in your face. It was a lot more fun back then, but you never shifted. You come on, you're doing your skincare, and you're like, we're going to talk about what happened today. The nonsense that the nonsense story my patient told me that they got told by their doctor.
Yeah. Well, social media is a weird place,
isn't it?
It's bizarre.
What made you go on there?
Every day I'm like, why am I doing this? Like, what is the point of this? So I was never a social media person. I had a Facebook when I was, a lot younger, and, after college. And then I canceled my Facebook. I've never been a social media person. I'm actually a very private person. I'm not a sharer. And when I started Lifestyles, everybody was like, oh, well, for marketing, you're going to have an Instagram and a Facebook. And, I said, okay, all right. So, I set up my Instagram and the Facebook and then eventually they could talk me to TikTok so that, I could market and people knew where I was. And that's the only reason. And I started to put stuff there, and it just went. And I wasn't expecting that. That was never my goal. So every day I'm like, what are you doing? Or like, do we want to do this? What's the point of this? But it's fun. I enjoy it. I do, people send me DMs, and I meet people, out and about every day, and they tell me that, things that they've heard me say has changed their life, and they were able to get the care and advocate for themselves. So I guess it's for something, but it certainly wasn't planned. Well,
your work is really important. I think it's such a tempered, logical approach. It's like you're in the trenches, you're doing the work, and you just say it how it is. And that isn't always super popular. I mean, popularity online comes from being really polarizing. And I think there's a couple different camps in the hormone space that are very, very where they are. And I'm always sitting in the middle, and I'm like, you got to go to the gym, ladies. You got to go to the gym.